everybody, it's Dr. Glockenflecken.
And Lady Glockenflecken.
Guess what? We are bringing our live show, Wife and Death, to Lebanon, New Hampshire, September 15th at 7:30 p.m.
That's right. Back to the Upper Valley at the Lebanon Opera House.
So I went to med school at Dartmouth.
Yep, I went to grad school there.
And we wanted to come back and put on a show for the community. We cannot wait. It's going to be a blast. You can find tickets at our website, glockenflecken.com/speaking, or go to LebanonOperaHouse.org. We'll see you in September.
Knock, knock. Hi.
Hello, everybody. Welcome to Knock Knock I, with me, your host, Dr. Glockenflecken. This is your one-stop shop for all things, almost all things eyeball related. I'm sure there's things I haven't come up with yet that I haven't talked about, but for the most part, this is where you can get your eyeball information and other things about the healthcare system and medicine in general. So, thank you for joining me. You might notice I have if you're watching on YouTube, we have updated our podcast studio. And at the very least, hopefully the video is a little bit better. Maybe the audio should be about the same. But at the very least, back here in the back behind me, you can actually see a Jonathan prayer candle and a limited edition Jonathan prayer candle. So I have Jonathan looking down on me, protecting me, watching over me as I go through this podcasting journey. So thank you, Jonathan. A head nod would suffice, but I appreciate you being here. Okay, so what we're going to do today, I'm so glad you're here. I have a couple topics I want to talk about. One is unionization, a hot topic right now in healthcare. And then after the break, there's yet another eye drop bottle recall. I swear this happens like every 6 months to a year. So something got into an eye drop bottle and now they have to recall millions of drops. And so we're going to talk about what effect that has on patients and on me as an ophthalmologist. All right. So first, let's jump into this issue of unionization, which is, there's been a lot of buzz, a lot of news, a lot of thoughts and opinions around unionization. There always has been, but in particular for healthcare, you're seeing a lot more of it. So just within the past few months, Banner Health, which is the largest health system in the state of Arizona, all of their hospitalists joined together and formed a union. We're talking hundreds of physicians. And that was notable because of how large the Banner Health system is. And you also had the nurses at BWH, Brigham and Women's Hospital in Boston. They had a one-day strike, largest strike in the state of Massachusetts, and are still negotiating a new contract with their employers. So, first off, the opinions around unionization, they're all over the place, right? This is not like me talking about, when I talk about the health insurance companies, it's like overwhelmingly 100% everybody agrees with me. That's easy to do. Like I love making fun of health insurance companies are great because nobody likes them. No, nobody likes them. Unionization has been different. I've done a couple of different videos about talking about these unionizing efforts or the strike at BWH. And a lot of support, a lot of people agree with what these groups of physicians or nurses or whoever it is that's striking within the healthcare field. A lot of people agree with it, but there's still a lot of people, a surprising amount of people, honestly, that are healthcare workers, doctors, nurses, that don't agree with it, that actually, are kind of lambasting this idea or just are against and don't think it's worth it, or that it's actively harming patients, or that it's bad for the profession, or just generally just against the idea of unionization, are very vocal about it. So before we get into that reaction, though, I had one question that came up when I did a video where I offered my support to the BWH nurses, just saying, we all need to stand together. Like, I think healthcare workers, however you feel about unionization, we should applaud healthcare workers who advocate for their patients, for themselves, and their profession. We should support that. I did a similar thing when I talked about the Banner Health union that's forming among physicians there. And so I got a question when I put this video out there about the BWH nurses, as like, why don't physicians have this? Because that's the thing. Like, nurses have kind of figured it out. They figured out this unionizing thing. There's unions everywhere for nurses. Most states, a lot of health systems out there have unions for nurses. So where are the physicians? Why have they not incorporated this or talked about it much at all until just like within the past few years, as resident unions are popping up? Banner Health, obviously, in Portland, Providence, Portland, the OBGYN physicians are unionized there. So there are, this is not a new thing. And there's a lot of people that think that physicians are not allowed to unionize. We can't do it, which is wrong. So I want to like talk a little bit about like what's going on with physicians. So first of all, the reason we're so far behind on like unionizing efforts is because historically we've all been independent. Like, you went to med school, you graduated, you went to residency, you graduated, and you went and you started a practice. That was what it was. And we're talking like, 20, 30 years ago, right? But over time, and whenever you're independent, you're a stakeholder in your own practice, or you're a contractor, you can't unionize in those situations. You cannot form a union among other contractor-based physicians, or practice owners in medicine. But over time, over the last 20 years, our autonomy, there's fewer and fewer independent physicians out there. I've been talking about this on social media, about what they tried to do at Peace Health, what they're doing at Valley Health, getting rid of the physicians there, bringing in SCP Health, private equity-owned practice, right? These types of decisions are happening everywhere, and it's slowly whittling away and taking away the independence of physicians. There are fewer and fewer new doctors going into private practice in independent, not just private practice, but independent physician-owned practices. All right, there's many more physicians that are being swallowed up by big health systems or being employed by these corporate management groups like Apollo MD, Sound Physicians, SCP Health. There's dozens of them in all different specialties. Those physicians are being employed. And so that's the bottom line here, is that there's fewer independent physicians and many more employed physicians. United Healthcare is the largest employer of physicians in this country. If you are a W-2 employed doctor, you absolutely can unionize. And I'm not telling people they need to unionize. I've honestly never been a big union guy. Like, I whenever it comes up in the news, I'm interested in seeing these trends happen in healthcare and how it's been changing over time. And I think what physicians, particularly employed physicians, are realizing is that a lot of these companies, these health systems, will just sell you out the minute they feel like they can get a little bit better return. They can make a little bit more money. Their margins will be a little bit better. They will add more patients to your schedule. They will pay you less. Look at Valley Health. All right. They're told their independent physicians in the emergency medicine department, their independent emergency doctors, that they were canceling their contract 2.5 years into a 5-year contract. You're done. Which, based on the wording of the contract, was allowed. They were able to do that as long as they gave like 6 months notice. And they're bringing on SCP Health, again, private equity owned staffing corporation. And what did SCP Health do? One of the first things they did were they told the independent doctors that they can come and join SCP Health. We would love here at SCP Health, we would love for you independent doctors to come join us as employees. But you're not going to be W-2. You're going to be 1099. You're going to be a contractor. Now, what does that do? Well, it's much better for SCP Health because they don't have to pay benefits, but also they don't have to worry about any unions from forming among the physicians because they're not employed. They are contractors. They're 1099. You can't do it. Now, I'm not saying, and I've not been inside SCP Health, so I don't know specifically if that is a reason they do that. I think it's just a general cost saving for SCP Health. I don't know if they're thinking that about, oh, well, if they do, they won't be able to unionize. But it's just one of the effects, one of the downstream effects of asking these doctors to be employed as contractors within your company, which honestly, I'm still trying to wrap my head around that. It doesn't really even make sense to me, but that's what they've been told. That's what these doctors have been told. So we're seeing over the years, especially the last 10, 15 years, more physicians are being employed in situations that are not advantageous for the physicians and also actively making their quality of life worse. Loading up your schedule, telling you what hours you have to work, telling you what kind of services you need to bill, how many patients you need to see, where to refer patients, how often to refer patients, all the quality metrics that some of which are just designed to like make sure the hospital is making a certain amount of money. And I think physicians are fed up with it. It's driving burnout. It's just cratering morale. And so, of course, you're going to, as the physician in that situation, be like, what can I do? What can we do to make this better? I've got kids in this community. I've set my roots down here. I've lived here for 15 years. I don't want to leave, but also I can't keep working under these conditions. So you're looking for protection. And nurses, they figured this out a long time ago. They figured out the whole unionizing thing. And part of that is just, again, physicians are behind because we've been practice owners. We've been independent. Nurses have been employed. That's generally how they your average RN is employed by a hospital or a practice or so. So it's just been more of an option for a lot longer. But physicians, we're just kind of catching up now because now we're also employed. And we see what happens when people take advantage of employed healthcare workers. And when you don't have any other recourse against these hospital systems or private equity firms or insurance companies like Optum, when you don't feel like you have anything else to do, you band together and you strengthen numbers and you form a union. So I absolutely see why people go this route. And why would another healthcare worker, regardless of what you do, if you're a physical therapist and you're seeing another group of healthcare workers, again, people doing the work of healthcare, like seeing patients, with physicians, with any of these people I'm talking about, any of these careers, like in order to make money, you have to do the work of seeing patients. We're not talking about like passive income here. We're talking about you're doing the work, you're seeing the patients. Why would another fellow healthcare worker get mad at a group of nurses or a group of physicians unionizing and asking for more money? And usually they're asking for more than just money. They're asking for staffing ratios, to make care safer for patients. What's wrong with that? And I got some comments when I posted the video about the nurses. And I knew that not everybody would agree. Not everybody agrees that unionizing is the best thing to do. Honestly, I don't think for physicians unionizing is not ideal. It's not ideal because the best thing to do would be to have independent practice, to own your own practice, to be able to practice medicine the way you want to practice. But again, that is mostly being taken away from us. Some specialties, they're choosing to sell to private equity and become employed. Right? That's a different situation. But there's a lot of doctors out there that are having employment thrust upon them through no fault of their own, just because a hospital decides to cancel a contract and go with a private equity firm. Take it or leave it, independent docs. This is the way it is. By the way, you're doing a great job taking care of patients. It's not that, all right? It's just, we need more money. So I think it's counterproductive for us to get mad at each other, to be negative and disagree with another group of healthcare workers for taking a step toward unionizing, even going on strike, in order to get what they feel like is adequate pay, adequate working conditions. I got some comments about, do you know that there are 12 nurses at BWH that make over $300,000, while physicians haven't had a pay increase in 5 years? Actually, no, I didn't know that. But now that you're telling me that, you make a great case for why physicians need to be unionized. Like, this is not a zero-sum game. There's a big pot of money for healthcare expenditure. And more of that needs to go to people who see patients. And some groups are just better at advocating for themselves than others. Now, why would that make me mad? That like nurses are just great at advocating for themselves and for their patients. They do it in an organized way. Someone help me, and I'm open to feedback here. So if you're watching this, like, go leave a comment on the YouTube channel at Glockenfleckens and let me know what I'm missing. Now, I understand why employers would not be happy about unionizing. I get that. Like, I understand the reasons why. It's more cost, it's more headaches, it's more, dealing with a union, and it's taking away your time from doing other things and running whatever the business is. But why other employed healthcare workers would be upset? Like, do you feel like they're like a nurse getting more money takes it away from you? Because I don't think that's the case. I think that's something the hospitals and employers would try to tell you. Well, we're already giving so much money to nurses. We can't pay the physical therapists. We can't give you a raise. We've already given it to the nurses. That's a way to sow discord. And I encourage us all to look at where the money is going. Is it to executives? Is it to new buildings? Are they acquiring? How much do they have in holdings? How much real estate do they have? What was the hospital's net profit over the last few years? Where's that money going? Because the majority of it should go to the people taking care of patients. As an employer, you should, in healthcare, take care of the people who take care of the patients, and everyone's going to be happy. And until we have radical transparency, be skeptical of any company in healthcare that says, "Oh, we can't pay you because we already paid this other worker." I think there's enough money to go around to make everyone happy, to make all the healthcare workers happy. And to employers, to people that are shareholders in a nonprofit health system, you want to squash those types of arguments? Show us the numbers. Show them. And I'm not talking about publishing a price list that's hard to interpret, that has a bunch of extra data. You show your prices. You also show how much reimbursement is, how much insurance companies, the payers, are paying you. Show your margins. Show everything. Why would a nonprofit not do this already? But show all the numbers. Salaries are already public. We can already see that. But there's so much more that we're not seeing. So just radical transparency. Show us all the contracts you have with your payers. That way we can all actually see where this money is going, how much you're making, how much you're actually making on all these different services that are being done by the healthcare workers. Radical transparency. Show us all of that. And then you can let us decide if you actually don't have enough money to give raises to all these groups of healthcare workers. Otherwise, like how can we know? We have to just advocate for ourselves. So I don't know. I'm frustrated that people are there's so much infighting among healthcare workers about stuff like this when way to go, nurses, way to go, doctors. Like, protect yourselves, protect your profession, protect your patients. All right, let's take a break. Hey, Kristen, it's hot outside.
It is a summer.
You know what that means?
What?
T-shirt season.
That's right.
I love a good t-shirt.
Mm-hmm.
You know who makes a good one?
Who?
Cozy Earth.
They do.
They're all-day tees.
Yes.
They're soft, they're comfortable, but they're also cool.
Yeah, and the rib knit pajamas, I really like those because they have like a good weight to them, but they're still like cool and breathable.
And Cozy Earth stands behind everything they make, a lifetime warranty and 30 days of hassle-free returns if anything isn't quite right.
Nothing to lose.
This summer, Cozy Earth's all-day tee and rib knit pajama set are the two things I keep reaching for. Made from viscose from bamboo, breathable, soft, and built for the season you're actually living in. Summer lives here, and honestly, so does cooling comfort. Head to CozyEarth.com and use my code KNOCK for an exclusive 20% off. Again, that's code KNOCK for 20% off. And if you see a post-purchase survey, mention that you heard about Cozy Earth right here on Knock Knock High. Hey, Kristen, remember how you love eyelid mites now?
Mm-hmm. Sure.
Well, there's a lot of confusion out there. I want to clear something up.
Okay.
All right. People think they can get eyelid mites from dogs and cats.
Can they?
No. These particular Demodex mites are specific to humans.
Okay.
So spread from dogs and cats is not expected. That's a myth.
Can't get them from cuddling our poodle.
No. Demodex mites that cause blepharitis live on humans. Most adults already have them. They just usually don't cause problems. It's when they overgrow that they can lead to itchy, red, irritated eyelids. Those little collarettes.
Mm-hmm. The crusties at the base of the eyelashes.
Right.
And the good news is there's a prescription eye drop available for Demodex blepharitis.
That is great news. To learn more about eyelid health and Demodex blepharitis, visit miteslovelids.com. Again, that's miteslovelids.com to learn more. This ad is brought to you by Tarsus Pharmaceuticals. All right, we got a great big recall going on. And this time it hits really close to home. So over the years, there's been eye drop recalls, and usually it's these over the counter, homeopathic drops. Somebody doesn't package something correctly, and Pseudomonas gets into it, and all of a sudden people are dying. Like that happened a few years back, and it's often like off-brand, like the not the brand name things. I don't know if that really matters, but it's usually over-the-counter stuff. Well, this time we got a major recall, 2.5 million bottles of Prednisolone. Prednisolone. This is like one of the most commonly prescribed eye drops out there. So it's Lupin Pharmaceuticals, which is a company based out of India. Mostly they do generics, which Prednisolone is a generic. It's just steroid. It's the most basic steroid medication. Every patient who gets cataract surgery generally gets Prednisolone, gets some kind of steroid, either injected into the eye or as eye drops. And so this is a major deal. We haven't felt the repercussions of this recall just yet, but 2.5 million bottles of this stuff. Unfortunately, this is not the only company that makes Prednisolone. Like there's many of them that do, but particularly in India, where they do so much cataract surgery there. Like I've seen videos of the way they do cataract surgery at Aravind Hospital, which is like the big eye hospital in India. And at least one of them. I'm sure there's many big hospitals in India, but this is kind of the most famous eye hospital. And the surgeon will be doing a surgery. They're sitting on a swivel chair. They'll do a cataract surgery, finish it, take the gloves off, New gloves, turn around, like swivel around 180 degrees, and there's another patient waiting. Do the surgery, discard the gloves, new gloves, swivel around 180 degrees, do the next case, back and forth. You could do like 60 cases in a day doing that. It's remarkable, honestly, the efficiency that they have because they have so many patients to take care of. Well, and usually they're like also, they're going to be doing dropless where you just inject the steroid into the eye at the end of the case. But imagine having a recall of all these bottles, and what do you do? Because you have to control inflammation after surgery. So it's a huge deal. And what was the fortunately, it wasn't a recall because we had like deaths. It's because a foreign substance. I'm not sure if they know like what the substance or have divulged what the substance is, but a foreign substance has been found in these bottles, and so they preemptively did a recall. Thank goodness, because what we don't want is for someone to find Pseudomonas or some kind of strep species. You get eye infections that then travel to the brain, cause encephalopathy, encephalitis, and patients die from it, which is something that could happen if you don't get on top of these recalls. So prednisolone, if there's a shortage, you might have some trouble getting some post-op drops. Hopefully not, but it's a major deal. And then the last thing I want to just mention here before I go is I think I need some help from you guys. Do you have anybody have any suggestions for learning medical Spanish? Because we're opening up a new clinic in a predominantly Spanish-speaking community close to Portland, and I know just a handful of phrases. I need some help. What's the best, easiest way to learn medical Spanish? Like in very focused medical Spanish, by the way. Like I need like eye stuff. All right. So I know my directions. Derecha, izquierda, abajo, arriba. Like mira derecha. That's one of my favorite things to say. I know, what else do I know? I know like, niceties, like how to say hello, goodbye, all this stuff. Um, and so, but I need more. I need help. So please send me your recommendations. You can email me, knocknockhi@human-content.com. You can also just leave a comment on the YouTube channel. But I could use, do I do the, what are the Babbel? There's like Babbel, there's like Rosetta Stone. There's like all these, I hear ads for them, but I imagine that's not like medical Spanish, like helpful. And so, yeah, easiest way I can learn besides traveling somewhere and immersing myself in the Spanish language in a hospital somewhere, because I don't think I have time for that. So what else can I do? Help me out, folks. I guess I could ask ChatGPT or something, but I would love to hear like real life suggestions from actual people who have been in this situation where they needed to learn as much medical Spanish in as short a period of time as possible. Please help me out. And also, like, why did I not learn Spanish earlier in life? It's a good question. I took German in high school. Why my parents let me do that? I don't know. Maybe they were just like, oh, he's exploring his options. And, he wants to learn German? Sure. No. See, my parents, what they should have done, and I have great parents, put their foot down and said, what the hell are you talking about? German. You want to learn German. And not, you live in Texas, my son. Like, learn some Spanish, okay? That would have been nice. That's okay. Like, they did the best they could. They didn't know I was going to become a doctor and be asking this on a podcast, 20 years later. So anyway, that's it for Knock Knock Guy. Thank you all for listening. I'm your host, Dr. Glockenflecken. Thanks to my executive producers, Aaron Corney, Rob Gilman, and Shanti Brick. Editor and engineer Jason Portizo. Our music is by Omer Benzvi. Knock Knock I is a human content production. I'll see you next week.
Knock, knock, goodbye.
Thanks for watching the episode. You can find more on that playlist over there. If you prefer to listen, or you just had your eyes dilated, you can binge full episodes wherever you get your podcasts, or join the party over on Patreon, where you get early access episodes, hang out with us, get lots of exclusive bonus content, Hope you subscribe, leave a comment below. Let us know what you think.